a disclaimer: the health connection has nothing to do with Obamacare. But what I'm going to do is give you a little, some perspective, some personal perspective in terms of how I got involved in, looking at the possible connection between climate variability and the changing climate extremes, and modulating or changing certain aspects of health, human health. So my first slide here would be just another way to show, just like medicine is a complex issue, because it's dealing with a complex system. The world is a complex place. Climate has great complexity in terms of all of the things that are involved in climate change. So you have the human system, which is the driver of the changing climate via the production, the use of fossil fuels and the injection of carbon dioxide and other greenhouse gases. But then the climate is changing, and that feeds into ecological systems, impacts and vulnerability, and so it's often used to say just modeling the climate has taken 30, 40 years to get to where we are. So it has been a step-by-step improvement in our ability to understand and model the various aspects of the climate system. So I thought I would make a graph that even I can understand. And so you got a climate driver, whatever it could be, changes in hydrologic cycle, increasing heat waves, droughts, etc. So you have vulnerable populations, and depending on the socioeconomic systems and the political systems. So, and those vulnerable populations then through that climate driver, you either have ineffective intervention, in which case some of the health impacts of that climate driver will be enhanced, or you have effective interventions, and of course the health impacts are reduced. And it's not in those, there's a lot into those arrows, because quite often we know how to do effective interventions, but there are some blockages. There are some basically economic or socio-political acts that prevent the effective intervention, and so you have bad outcomes that go a certain, that can persist for a while, and eventually perhaps, the political system, gets its act together, and like for example, the fact that the Congress hasn't passed the Zika bill shows how the political establishment, prevents effective intervention that it's that is due to precisely that, the human part. So here's an example. Failure to plan for natural disasters often lead to dire consequences. And in the past 2 years, we've had very, very severe heat waves in India. Over 330 million Indians, 1/4 of the country's population, have been affected by the drought. In this western state, where over half the population is dependent on the rural economy, the effects are severe. An average of nearly 9 farmers committed suicide every day last year, primarily over debt related to crop failure. And this May, the Supreme Court scolded several state governments for their ostrich-like behavior and demanded the creation of a national disaster mitigation fund within 3 months. But nothing has happened yet. A principal advisor told the court. So once again, this is, goes back to the question of, there's a problem, but you have ineffective action, due to the incapacity of the system to work in the proper way. So I go back to the 1990s. Climate. We began thinking about how climate change, might be impacting human morbidity, disease, illnesses. But the focus was largely on mosquito-borne illnesses. I organized a workshop with the help of some of the folks that are shown there on the effects of climate change and health, and this was in Belize in 1997. And so some of the folks that are shown there, Paul Epstein from Harvard, he was one of the early persons looking at this issue, and Ulises Confalonieri from Rio de Janeiro, was at Fiocruz at the time. Eventually, we actually were able to get a group to look at vector-borne diseases and climate change via a organization which is still in existence, the Inter-American Institute for Global Change Research. We ran into the same kind of problem. In other words, we were interested in seeing if we can make these connections, but we hit a wall in that the data that would allow us to connect a climate driver, with a health outcome was not there. We just could not have enough data to really be able to do a cause and effect or a detection and attribution type study. And so, that group, disbanded. So here are some other folks that were working. Again, we looked at climate and human linkages in a historical context. We went back to see, how climate variability affected health outcomes in the past, particularly some of the great famines in the 19th century in India and in South America. And indeed, we found that during the years in which there was this large pandemics, there were some major global climate anomalies, mostly associated with what's known as the El Nino and sun oscillation, the ENSO phenomenon. So then by the early 2000s, it was the focus shifted a bit more towards heat waves and the effect of extremes, particularly because like Jay noted, in 2003 there was this tremendous heat wave in Central Europe, Western Europe, mostly focused on France, and at least somewhere in the numbers go between 20 and 70,000 excess deaths associated with that particular episode. The mid to late 20s, there was an increase in emphasis regarding connections between the climate stressors and human behavior, so we began to actually come back to the question of, well, it's not just the climate, there's a lot involved in terms of the human behavior. You want to understand what the effect is. And so, here are some of the folks, Jonathan, impact of regional climate change. Tony McMichael was also an early a researcher in this area. Chris Abbey, Sarah Kovacs, and Bettina Mene, also from England. They were very active in looking at some of these questions. And then the 2010s, climate change, environmental and human factors leading to chronic illnesses, which is, now where we are now. And so, again, Tony McMichael looking at globalization, climate change and human health, so sort of looking at movements and connectivity and environmentally induced occupational diseases, chronic kidney disease, multifactorial origin affecting sectors. So this is sort of a little bit of a brief look at how some of the work that I've been involved in, at least peripherally. So coming back to the climate part, It's driven, as Jay noted, it's driven by unprecedented rapid increase in greenhouse gases in an evolutionary context. That is, I mean, it's happening at a much faster rate than for most of the world's climate history has shown. So these changes are very fast. They're fast in comparison to human lifetimes. So they're not on geologic timescales. So by analogy, the body temperature, small changes in planetary temperature observe warming by almost 2 degrees. This is a big deal. Cause and effect has been established, I think, without any reasonable doubt. The increase in greenhouse gases has led to overall observed planetary warming, and a continuation of the current rate of growth of greenhouse gases in the atmosphere will result in extreme and unprecedented environmental conditions. So here's the same graph that Jay showed, the carbon dioxide record from Mauna Loa Observatory. We've now crossed the 400 parts per million, and you can put it in context, 800,000 years, and we're essentially almost doubling the CO2 from the background levels that existed over over essentially the human evolution timescale. So with that, of course, it's you can see how temperatures have continued to increase. Here's the first half of the year, which when I got this, we could now go through the month of August, but it's basically the same thing. And as we go forward in time, each year tends to be warmer and warmer. There in 2015. This particular red curve was the warmest year on record. Now 2016, the black curve and the two dots, the two stars there for June and July, I guess. Yeah. So basically, we're going to set another record somewhere in the 1 degree above the early 20th century record. And what it looks like, here's a picture of the warmest monthly anomaly on record. Basically much of the globe is very warm to near record heat. And what happens is that as we go forward, a greater and greater proportion of the planet is above normal, above the background level, the historical level. So for the better part of the 20th century, you had variability. You had some, basically the surface of the globe was below normal or above normal. But from about the mid-70s on, a greater and greater proportion of the planet's surface is above normal. So there are very few places to hide now in terms of avoiding this warming trend. And one of the interesting things, and I don't know if I can, let me see if that'll go. No. Well, that's too bad. Let's see. Here it is. Okay, so the left side is the amount of carbon being put into the atmosphere in time, because going around this time, and these two are the same. So this is time axis, and there's an increase. The middle one is the CO2 concentration in the atmosphere, and the one on the right is the global temperature. So it's going around each. Basically, you have the years, the months of the year. See if I can get it again here. So as the greenhouse gases, the greenhouse concentration is increasing, and the temperature is also increasing as it goes along. It's a very nice way of showing the real tight connection between increasing greenhouse gases and increasing temperature. This is developed by some folks at the Hadley Center in the UK. And Jay has also shown that we have a choice. We can all burn together, or we can try to save ourselves separately. But somewhere in that large range is where we're going to end up by the end of this century. And what does that mean? Well, unprecedented wildfire behavior is now evident in a very large number of places. You have tremendous heat waves now occurring very high at higher latitudes. And you have seen extreme fire behavior in high latitude forests where you're actually getting, in a season, millions of acres being burned, which adds to, again, to the atmospheric burning of greenhouse gases. And I like this picture because it does show, we now have year-round California wildfire season. And that didn't used to be the case. It was basically a fall season maximum. But in the last 2 or 3 years, we've had major fires in California every month of the year, right through the winter. And this is a great picture because it shows one of the quintessential human environments in LA, being in the front, with the fire, cloud in the background. So the juxtaposition of the two, how we have changed the landscape in terms of urbanization and how we're changing the landscape in terms of fire behavior. It's really a good one. Again, we're seeing greater and greater degrees of warming. Now we're seeing temperatures that are exceeding 50 degrees centigrade, 100 and high 120s, leading to, once again, a number of deaths, a large number of deaths. In the United States, just this past summer, we had a tremendous heat wave. For several days, we hit between 115 and in the low 120s in parts of the Southwest. I was in Tucson, Arizona for the 115, and I tell you, it's something else to experience. Jerry Meal has done some nice work showing that for the United States, the number of record highs has been great, gaining on the number of record lows set. And this ends in the 2000s, but if you added the 2010s, the trend continues towards a greater number of high temperature records being set as compared to low temperature records. The warmer nights are a hallmark of a climate being heated by greenhouse gases, and as you can see now, we are having very warm nights, which have an effect on the body and on our ability to, for those who don't have air conditioning, to survive these heat waves. So we wanted to bring out the concept of tipping points in the global climate system. Natural systems often respond to seasonal changes, and they include phenological clocks that modulate a range of ecological functions such as spring flowering, plant emergence, bird migrations, etc. And the geographical ranges of plants and animals is controlled by a number of factors, with climate being among the most important. So the point being, crossing certain natural thresholds can result in unanticipated and unwelcome outcomes. And those include, the potential for, rapid types of epidemics. And of course, I think that we need to focus on the regional scale. We know that we know that on the planetary scale things are warming fairly rapidly, but it doesn't happen at the same rate everywhere. So even in an area, relatively geographic area, small as the continental United States compared to the globe, you still have some areas like the Southwest which are warming much more rapidly, and some areas in the deep South which are warming relatively small, relatively little. So again, important to emphasize regional aspects of climate change, Central America being one of the areas that essentially have connected us in this room. These areas of the western slopes of the Cordillera are the areas with a large number of CKD and T cases. In the paper that we published recently, the size of the epidemic correspond to where the average max temperatures are warmest, and the rate of change, the rate of increase of those maximum temperatures has been greatest. So I think the international bodies have recognized that this changing landscape and changing level of heat waves is going to be an important issue going forward. So they just last year promulgated in a report the need to develop a heat wave and health warning system. You can read about it's an extensive report, but what that could be useful for is essentially trying to develop some funding and some level of support, for the connection between heat waves and. So, Rick, this is the last one. When we started out, from Rick's efforts, we essentially are trying to establish a climate and health partnership, and some of the things that, in my opinion, are likely to be part of how this thing is structured. We're talking about interdisciplinary collaboration at the interface between climate, water availability, and disease. A focus not only on the potential spread of infectious diseases, but in particular for diseases associated with dehydration, associated kidney disease, and focus on regional hotspots such as Central America and Southern Asia, as Jason pointed out, as well as potential hotspots in the agricultural valleys of Colorado and California. I mean, there's also some problems associated with agricultural workers and increasing heat, which is focused on the Western United States. So that's the last one. Thank you.
Okay, we have some time before the coffee break. Questions?
Jason.
So I just noticed, I think a lot of us have seen this, but the spike in the carbon dioxide, the heat, really kind of takes a launch in the 90s, right? Takes a huge jump, and that's fairly obvious, I think. You start seeing industrialization, globalization take hold in low middle income countries, and the neoliberal, and I'm going to get slightly political here, but I want everybody. The traditional model is that's been great for everybody, right? That's the argument made, that the quality of life has gone up in these places, that there's been economic gains.
Yeah.
But I'm wondering if we can get an economist on board the group sooner than later who can kind of do the cost-benefit analysis more to what you've shown and what Jay's shown and what the risks are. And, I think the theory I'm aiming at is fairly obvious, so sorry for being Captain Obvious.
Well, yeah, I mean,
there's a loss here, not a gain.
Energy and economic output are essentially correlated to about 1.0, so
Yeah.
you need, but the energy doesn't have to be fossil, and it doesn't have to be wasteful, so you can get the same unit of output. If you're more and more efficient, you can get the same output for the same input. And so the transformation from a fossil-based economy to a renewable one is what I think that's going to be the path forward. There's a lot of work being done on the economic side to look at, how we get from here to there, and how much it's going to cost, and, who is going to pay. But I think we have made some pretty good progress, I think, in the last 15 years in transforming, a large part of the industrialized world from a high fossil, like coal, to both renewable and natural gas, for example.
A quick question on that. Obviously, the fossil fuels are primarily driving the greenhouse effect, but what's the role of loss of tropical rainforests in the CO2 balance?
It's a contribution, but does anybody?
I think it's like 20% or more, I believe, in terms of the
20%,
land use
I would say
change.
20%, but not more than that.
So it's significant.
Yes.
Listening to both talks this morning, it strikes me the dilemma we face, and I don't have an answer to this, I just want to put it on the table. I was thinking about the disaster fatigue. You were describing India's approach, the Supreme Court's demand that there be a way to manage the disaster, and the WHO is planning to manage the disaster. That's the human need to anticipate and deal with disasters, but the problem is, if all of our emotional and intellectual energy goes into managing disasters, we have no time left for managing the prevention. And so it seems to me we face that dilemma because people just can't tolerate too much of this. And how do we get them attending to preventing what you can't count versus fixing the problems that are horrendous?
Yeah, I think the hurricane problem is is an interesting one because it involves all kinds. It involves the science, it involves the communication is important, and then the people on the ground that are going to try to prevent the disaster from happening. I mean, the disaster is coming, and we can tell you that you're going to be hit by a hurricane in the next 24 hours, and in this part. But if nobody does anything and they discount it, then then you have a huge disaster.
The anticipation I'm thinking
Yeah.
of is the one that both of you have talked about, which is the one going forward the next
Oh.
50, 100 years.
Yeah, oh yeah.
And the attention, not surprisingly, gets focused on firefighters,
Sure.
firefighting
Then now, yeah.
floods and
Yeah, sure.
hurricanes.
Yeah.
This sort of reminds me of the adage, you don't want to be mopping up the mess without turning off the faucet or fueling the fire and things like that. And I think that two things. One is I think that this is actually to both talks, that really that this is a public health, a health issue, has been communicated for a long time. And even President Obama, when he chose to announce the Climate Action Plan, he did it from a hospital, saying climate change is a health issue. So that message is out there, and it's been out there. And I think the key thing, especially for this group, is to bring in more of the mainstream medical consequences and basic science that that's really important to get more of the mainstream medical community on board and not just the public health community that's been on board for a long time. And at the same time, as David points out, the awareness and the fear factor, people need to know this is a crisis. But as a doctor will say, it's not even worth diagnosing something if you don't have a cure. It's not even worth running the test if you don't have anything to do about it. And this is where I think there's a burgeoning area in this field that's growing faster than many in the area of the health co-benefits of energy policy. And I think that we need this two-pronged approach of bring on more of the science and the mainstream medical community, where I think this group can help. At the same time, show and I'm actually going to go into this tomorrow, about that there are actually early term wins, even if you don't believe in climate change. Simply getting to a low carbon economy has huge health benefits.
Right.
So I think that's something. And my final note is that this group can really leverage by tapping into other initiatives happening. There's a lot going on, especially the Global Climate and Health Alliance, which is, it's global. And I think that there's a lot of parallel initiatives. They need to be organized and connected. So this is something that I want to really make sure would happen out of this group.
Yeah, I just make a comment on your comment. In climate change, the public face of what's happening is the Weather Channel, or whoever is giving the weather segment of the news. And over the last 20 years, there's been kind of this mismatch between climate science and climate communication and what the public sees, which is whoever that broadcaster is. And so I think, again, the public connection to who do they connect with in terms of medical information, other than pharmaceutical advertising on television, and it's your local doctor kind of a thing. So I think you're right that that there's messaging that would really be impactful if we could reach the right people.
Well, I mean, and in the end, I mean, you can take the other side, which is, essentially the fossil fuel industry has used communication very effectively to tamp down on the public's understanding and feelings about climate change. So it's all about communication. They understood that very well. They did with tobacco, right? So they've done it with fossil fuels. So it is a communication problem in the end, in terms of getting the public behind some set of actions. But
Okay, thanks. So we have